This one hemoglobin diagram can give you so many MCQs in exams. So if hemoglobin confuses you, this video will fix it forever. What is hemoglobin? Hemoglobin is a conjugated protein present inside the RBC. Globin is a protein part, heme is a non-protein part. We will discuss each part in detail. Now let's come towards the protein part. It is made up of 4 polypeptide chain. That's why it is called tetramer. 2 alpha and 2 beta. Can you see in the picture? Now each chain has a specific amino acid sequence. Just remember one amino acid, histidine. I will let you know later on. Now let's come towards the non-protein part, which is heme. So each globin chain is attached to one heme group. So 4 heme group per hemoglobin molecule. Can you see those purple ring? Important point, iron must be in a ferrous form. If it is in a ferric form, iron cannot bind. So 4 oxygen molecule per hemoglobin. I hope it is clear to you guys. Now the oxygen we breathe enter the lungs and binds to the heme iron in the red blood cell. Note important point, oxygen bind to the heme iron. Now hemoglobin carries this oxygen to tissue where oxygen levels are low and release it so that they can use it for energy. After using it for energy, they produces a CO₂ as a waste material. This CO₂ diffuses into blood and enters into the RBC. Inside RBC, this CO₂ reacts with water. You know what happens after reaction? CO₂ plus water forms the carbonic acid and then disintegrate into hydrogen ion plus bicarbonate. This hydrogen ion is problem because if there is increase in hydrogen ion, blood become acidic. So we have to fix it. Now here comes the role of hemoglobin. Hemoglobin acts as a buffer. It binds that hydrogen ion using its globin chain and this prevents the hydrogen ion from lowering blood pH. Now this globin is protein made up of many amino acids. I told you earlier, remember histidine. So this histidine accepts this hydrogen ion. Now look at this picture. Necklace is your globin chain, beads are your amino acid, one special bead is your histidine. This bead can catch and releases that hydrogen ion. Now you know this hydrogen ion is accepted by histidine. What about this bicarbonate? This bicarbonate leaves the RBC and enters into the plasma. And then chlorine enters into the RBC from plasma to maintain or to balance the charge. So now blood carrying bicarbonate and carbon dioxide return to lungs. Then oxygen enters into the RBC and bind to the heme of hemoglobin. So what happened at this stage? Haldane effect triggers the hydrogen ion release. So the hydrogen ion that were bound to histidine on globin releases. Now this hydrogen ion reacts with the bicarbonate. Now you will ask me, how come bicarbonate enters over here? Because it goes into the plasma. So by reverse chloride shift, it again enters into the RBC. Now the reaction takes place and CO₂ is now free gas ready to diffuses into your alveoli.